I'm Dr. Lang. Nice to meet you.
Hi.
How are you doing today?
I'm alright.
What symptoms are you having?
I'm feeling pretty tired, nauseous, I have a poor appetite, and I've got some pain over my liver.
Have you traveled out of the country?
I just traveled to Africa, and I may have consumed some contaminated water. And I don't know if this is important, but I also have been diagnosed with hepatitis B before. But I think this is something different.
Wow, this is so rare, but you may have hepatitis D or E. Let me check my chart here. I'm gonna order a blood test. This will confirm. I'll also refer you to our dietitian. If you've been infected with hepatitis B, it probably means you have hepatitis D and E. The infection should resolve on its own, but please go see the dietitian.
Okay, I will.
Come in.
Hi, I'm Dr. Lang. Nice to meet you.
Nice to meet you.
How are you doing today?
Not that great.
Well, what are your symptoms?
So I took note of my symptoms, and lately I've been feeling like kind of feverish, tired. I've had like a lot of belly pain, so I haven't really been eating that much. Vomiting. That's what brought me here today.
All right. Have you traveled to Africa, South America, Russia, Asia, or have you had any contaminated drinking water, food, or sewage lately?
Actually, I have.
What? Where did you go?
I went to Rio in Brazil a couple weeks ago and to visit some friends. But I have looked up my symptoms on the Mayo Clinic, and I'm pretty sure I just have the flu.
Mayo Clinic. Well, let's see. I'm gonna have to check some blood tests. So, unfortunately, the blood test results came back positive. You do have hepatitis A, but it's no worry. Have you been vaccinated?
No.
Okay, well, you need to make sure that you get vaccinated for hepatitis A. But this will likely go away on its own. Just get plenty of rest and stay hydrated. But you should visit our registered dietitian. She'll be having an educational forum to help our patients learn more about hepatitis.
Okay. Thank you so
Okay,
much.
bye.
Come in.
Hi, I'm Dr. Lang.
I don't think you want to touch me.
Oh, how are you feeling today?
I feel like I have the flu. I'm yellow. My urine is dark. I have pale bowel movements, and according to the internet, I have hepatitis B.
Wow, well, we're gonna have to run a blood test to make sure that's the case.
Well, once you confirm, I know I'll need a tenofovir and disoproxil, a pill taken once a day with few side effects for at least 1 year or longer. This is considered a first-line treatment and has an excellent resistance profile, approved in 2008. I've already incorporated a diet change of 2,000 milligrams of sodium, small frequent meals, adequate protein, and low fat.
I'll be right back. We need to check your labs.
So you found out, right?
Your hepatitis B blood test came back negative. Looks like you're fine.
What? Are you sure? I did all my research.
I'm sure. You just have the flu.
Is there anything I can do just in case I do have hepatitis?
Well, I can refer you to our registered dietitian. Here's a handout to visit her. She's a little crazy.
Come in.
Hi, I'm Dr. Lang.
Hi.
Nice to meet you.
Nice to meet you.
So, what brings you into the office today?
Well, haven't really been eating much lately. I don't feel hungry, and I'm tired all the time. I also have been having some really serious abdominal pain, so.
I'm seeing some jaundice here. Well, what's that big tattoo on your arm?
Isn't it cool? My friend did it at a party a couple months ago, and it was free.
Was the needle sterilized?
Who knows, but it looks cool, right?
I think I'm gonna have to perform a liver biopsy.
I had no idea this was that serious. Can I call my mom?
Here in the surgical procedure room, the biopsy on Athena is about to happen, and we're gonna get started. We're gonna just put in a local anesthetic. All right, the liver biopsy is complete, and I'll be taking this away for lab research. Hi, Dr. Lang again. So, the biopsy came back. Let me just look in my notes here. Are you having any pain or discomfort?
I mean, I'm really nervous to know the results of this test, but like...
You definitely picked up hepatitis C from that tattoo of yours. You really need to be more careful. Sharing needles can be dangerous. I'm gonna call in an antiviral drug, Dacltasvir, to get rid of the infection. But I'm gonna refer you to our registered dietitian so you can learn more about this. Don't worry.
Thank you. Hey guys, thank you so much for coming out to our class. My name is Jessica. I'm the dietitian here. Dr. Lang told me that she referred all of you to see me so that we can go over your hepatitis diagnoses. Can everyone just introduce themselves and say a fun fact? We'll just start with you.
Okay, so hi, my name is Beth, and I've been to 50 countries in 1 year.
Hi, I'm Jennifer. I have already had hepatitis. I've already gone through this whole process, but apparently I've been infected with another virus, so I'm back.
My name is Tori, and I actually don't have hepatitis, but I wanted to come just in case I got it.
We love people to be educated. So let's get started. First, we're going to talk about some background information about hepatitis in general. So hepatitis is a chronic infection of the liver. Inflammation of the liver tissue can occur due to alcohol toxicity, a virus, medication, or fat deposition. The liver helps your body to digest and store nutrients from food. When you have hepatitis, your body cannot use the food as well as it would when you're healthy. Pretty crazy. Anyways, does anyone have any questions before I go on?
Okay, so what should I be eating to feel my most comfortable and strong?
That is a great question. I was just about to go over how y'all's diet can affect your symptoms and health while dealing with these diagnoses. You may feel better and more comfortable if you eat 4 to 6 small meals per day instead of 3 large ones, the classic breakfast, lunch, and dinner. This will also help you stay stronger, having a regular eating schedule for yourself with a meal and a snack every few hours, and this is going to help your body process your food effectively.
I have another question. So, what about my weight? I've lost so much weight, so I just want to make sure all these meals you're gonna make me eat will actually
Oh God.
help me gain this weight back.
I just zoomed in on your feet.
Don't do that.
Well, you should probably weigh yourself at least once a week. And then from there, if your weight doesn't change, you're probably not getting enough calories. If you're having trouble with eating enough food, try consuming some calorie-dense beverages such as milk, juice, fruit-flavored beverages, nutrition supplement drinks such as Ensure and Boost, and hot cocoa. Controlling symptoms of liver disease and managing any other diseases that you have. So some of our monitoring goals that I'm going to be looking out for is healthy weight changes, like Tori mentioned, just making sure you guys are getting your calorie intake to really increase that weight back up to a healthy level, making sure our lab values are normal, and just making sure that if you guys are experiencing hypertension or diabetes, that we're really just having that under control. So we're just gonna, when I mentioned that your caloric intake, we're gonna just monitor the overall adequacy of your intake. So whether that's oral, enteral, and then that's just gonna make sure you're not deficient in any vitamins or minerals. Yeah, does anyone else have any further questions? Like if you need snack ideas?
I would love snack ideas, even though I don't have it.
Okay, I'm a huge snacker myself, so some really good recommended snacks that I would say for you guys are gonna be milk, yogurt, pudding, cheese, roasted nuts, peanut butter. As I mentioned earlier, Boost or Ensure are great high-calorie drink options, nutrition supplements.
Come in. Hi, I'm Dr. Lang. I don't think you would have touched. Did come back positive, and you have vitamin A. We are in the surgical procedure room. We're here in the.
Dr. Lang, what makes you call?